Good evening, everyone. A warm welcome to this new session. This is actually a session which you can tell this is a earlier pre-session for the diabetes session which is going to come up. So diabetes challenge or reversal session is slated on July 11th. So before that, sir wanted to start some session which can give you some idea or information about pre-diabetes or diabetes challenge or diabetes reversal session. Okay. So this session will be some introduction or some inputs from all of you so that everyone can understand what is diabetes. This particular session and other upcoming sessions, paid session will help you understand and treat yourself, your family, or your friends, or your patients, or whoever through neurotherapy. And please understand that neurotherapy is something created by Lajpat Rai Mehra sir, and it has been sent worldwide through our Acharya Ramachandran sir. He's an international trainer for this neurotherapy. So I request all of you to please stay in the session, keep your books, pens, everything ready. I request regular participants to always keep your notes and everything ready. And also share this link with all your friends and family so that they can attend. They can understand what is the upcoming paid session and they can take up the, registration soon because it is closing. And also not only that, please remember when you wait till last, the prices also might increase. So I request you to register soon after this session. Post your exact, screenshots in the main Joshi's Kerala Telegram group only. Because in Telegram group only, we can know who you are, what is your name, and then we can message you personally if we are unable to add you due to your privacy settings. And all the paid classes recordings will be there only in the paid session. It won't be shared with anybody else or anywhere else in YouTube's or nowhere. So if you want to have a paid class, then you have to pay and join wherever you are. You might be in US, England, London, wherever. You have to, all the PayPal information is provided in the message. Even, bank transfer information is shared in the group of Ramachandran sir. So the payments will directly go to Ramachandran sir. Please don't disturb by sending 1 rupee, 2 rupee and ask what have you received and all those things. You have to directly pay. If you are paying through PhonePe, please check the number and pay properly. If you are paying through, bank transfer or something like that, you please check each number, enter everything properly and then pay. If you are paying through PayPal, please enter the numbers, names or whatever, everything properly and then share the screenshot because if anything wrong, we won't be adding you to the paid group. Unless the payment is clear, I won't be adding you to the paid group and I want all the screenshots only in the Telegram group, please. So please understand, don't message us personally. We won't be able to add you unless you are in Telegram. So if you are not in Telegram, please enter into Telegram, create your Telegram and then message us in Joshi's Kerala group so that we can, add you to the main paid group. Now, without wasting time, with all your welcomes and with all your gratitudes, I'm sending it further to Ramachandran sir for this wonderful neurotherapy session. A warm welcome to you, sir. Good evening, sir. Please take over the session. Everyone, all your minds, ears, and books and pens nearby. Thank you. Please take over.
Thank you. At the very outset, I thank Joshi sir, Joshi's Kerala group, Anusha madam, and all the people behind the scenes who are making this very wonderful training program and a platform where healers and patients and everybody can share their experiences, their queries, and then they can get the proper answers also. So such a wonderful group for us, both as a healer and as a patient, everybody gets benefited. So today, I want to, next week, we are going to start the diabetes challenge second session. And before that, let us today, for all those who are wondering what I will be doing or what is neurotherapy, they are not very clear. So maybe some people are not joining because they are not yet sure about what neurotherapy can do, etc. So for clearing such doubts, I am going to give you a little bit of theory, a little bit of examples, and then tell you what we are doing. And of course, you are all free to make notes. The PPT is just there just to guide you. The rest of it, most of it, it's going to be through your ears and through your notes. And so now, as usual, we always start our prayer with a word of gratitude. Our salutations to the man of the millennium, the epitome of Dhanvantri, the father, pioneer, founder of neurotherapy, the most revered Guruji, Dr. Lajpat Rai Mehraji. So with this, today, we are going to talk about the practical workshop on treating type 2 diabetes through Lajpat Rai Mehra neurotherapy. And the first part is, it will be in several parts, just to give you an idea that it is quite structured. This lecture, as well as all my lectures, I try to structure them to the best of my ability. And usually people are quite happy with it. So it will be a structured program. And now we are going to see the hidden burden of type 2 diabetes in India. So normally, in any language nowadays, it is a common jargon. In Hindi, we say, "Jyada meetha mat khao, sugar ho jayegi." Or don't eat too much sweet, you may develop sugar or diabetes or whatever, words to that effect. So this is the common warning in almost all Indian households. But what is really diabetes? And more importantly, can we reverse it? Why this is very pertinent is because India is now called the diabetes capital of the world, and not without reason. No, according to a study, over 77 million Indians already have diabetes, and even more are unaware that they are pre-diabetic. By 2040, scientists are predicting that this number would cross 130 million, from 77 million to 130 million in just another 15 years. Really, it is alarming. But behind all these numbers, there is a silent suffering. So let us see in real life how this really appears, this diabetes, the problem. I just give you a few examples of patients whom I know. A 42-year-old IT professional from Pune. He came to us with feeling of tiredness, frequent urination, and brain fog. When he went to the doctor says, your sugar is 180, start metformin. He takes it very diligently, but every 3 months, the doctor has to increase the dosage. So he is very scared, but he doesn't know what else to do because he is not at that time. He had not come to neurotherapy. He came to neurotherapy much later. Then a 55-year-old school teacher in Patna. She was diagnosed with type 2 diabetes 12 years ago. She is now on insulin. But during the years, her legs are constantly hurting, her eyes are blurry, and doctor says she may be going in for kidney damage. She prays daily because she is a very religious person. She prays to God daily, but she feels helpless. Then another case, a housewife in Delhi. She is managing the kitchen, family, in-laws, kids, but she never has the time to take care of herself. One day she faints. Then on checking the reports, the doctor says HbA1c is 10.1%. And she says that you have had diabetes for years. So nowadays, most Indian families have someone who is either diabetic or pre-diabetic or suffering from sugar-related complications such as fatigue, nerve damage, eye trouble, kidney decline, or weight gain, etc. And the sad part is, even after taking medicines regularly, most of the patients, they never feel truly energetic. They always feel fatigued, tired, lethargic, and they always live in fear of rising numbers of complications. And most of them don't know the root cause why their body has this condition. And the worst thing is, they believe this condition is permanent. That is the problem. They believe that this condition of diabetes is permanent. But what is the truth? I say type 2 diabetes is reversible. It is manageable. And in many cases, it can be eliminated when you treat the root cause, the real cause. So the real cause is not just blood sugar. The real cause is insulin sensitivity, nerve function, digestion, and organ health. And all this is what Lajpat Rai Mehra's neurotherapy, which we abbreviate as LMNT, this is what LMNT does. So LMNT offers a path that is scientific, that is drugless, that is Indian in origin, and best of all, it is accessible to common people and no much capital outlay. So if you are tired of endless medications, or you are watching your parents struggle, or your relatives struggle with diabetes, then this workshop is your ray of hope. So now we come to the next part. The hidden burden of diabetes, then understanding type 2 diabetes. What your doctor may not tell you. Okay. So now let us understand the root mechanism of type 2 diabetes. And I will explain it in a very simple fashion, just as your dadi or chachi, she could also understand my talk. So what happens in diabetes? In simple terms, diabetes mellitus means a condition. It is just a condition where glucose is present in the blood, but your cells are not using it properly. The pancreas, we all know, produces a hormone called insulin. This many of you would have heard by now. So many people are talking about insulin. So that is made by the pancreas. It's a hormone. And what does the insulin do? It acts like a key, chabi. It opens the door of your body cells to allow glucose, that is sugar, to enter so that it can be used as energy. But what really happens in type 2 diabetes, either the pancreas is not producing enough insulin, or more commonly, the body has become resistant to insulin. It is like the key is there, but the lock has jammed. So what is the doctors say why this happens? They will say it is due to age, it is due to obesity, it is due to genetics, it is due to lack of exercise. While all these factors may be true to a certain extent, definitely I don't say that they don't play a part. But the LMNT view, the neurotherapy view, it goes much deeper. We say it is the failure of the neuroendocrine muscular system that leads to diabetes. What did I say? Neuro, muscular, endocrine, muscular system. Okay. So let us see, let us break it down. Neuro means what? Neuro means nerves. So now there are nerves going to every part of the body. We know it. But if the nerves which are going to the pancreas, the liver, and the adrenal gland, if these nerves are either weak or they are compressed, they have got jammed, they are got blocked, then because these organs, pancreas, liver, they all work under command from the brain. But if the nerves are blocked or compressed, then the organs won't work properly. So it is like sending a signal to a machine over a poor telephone line. So the pancreas, since it's not getting proper command from the brain, it won't release insulin on time or in the right amount. So that is about nerves, neuro. Then musculocirculatory. Muscles, we all know, they hold blood vessels and nerves in proper position within the body. But if the core muscles means the muscle of the abdomen, they are called rectus abdominis, and then the diaphragm, then the psoas muscle. If these muscles either they become tight or they become inflamed, then blood flow to the digestive organs gets disturbed. You know, I'll give you a very simple example. In Mumbai, we have a local train. Many of you might have seen or heard about it. And it's a very famous. Bombay commutation is always by local trains. It happens. And nowadays, of course, there is the metro. Now imagine a Mumbai local train is packed with passengers. And these passengers are the glucose in the body. But the doors do not open. The door is insulin. Insulin is they does not open. Then what happens? Even though the station has come, everyone is stuck in the train. That is, the glucose stays in the blood instead of reaching their homes. That is the cells. So the glucose is stuck in the blood, does not reach the home, that is the cell, and that is because the door of insulin does not open. So this is what happens in diabetes type 2. Then the third one is called hormonal miscommunication. Now we have a command from the brain. It goes to the pituitary. When from the brain means the hypothalamus. Hypothalamus sends an order to the pituitary. That pituitary sends an order to the adrenal. This is called brain pituitary adrenal axis. And what does this chain do? It regulates stress and sugar levels. But if you are constantly under tension, like your boss is pressurizing you, then you have bills to pay and you don't have the funds, or you get stuck up in traffic and are unable to reach the office in time, so you are worried about that, or you have poor relationships and with your family and friends, and as a result of that you are always stressed and tensed, then what happens? Your cortisol levels will always be high. And high cortisol means more blood sugar. And more blood sugar means more insulin resistance. So, the sentence I opened at the beginning, don't eat sweets, you will get diabetes. It is not the problem of just eating sweets, understand? In fact, many people with diabetes, they don't eat much sugar. But they are people who are either deprived of sleep, or they are having constipation, or they are stressed up, or they are leading sedentary lives, or they are breathing shallow. That means they are not breathing properly. Oxygen does not reach the cells. Or the worst thing which happens, which is very common today, is eating wrong combination. That means you eat roti, sabji, and then you eat fruit and curds. So then the digestion becomes haywire, because fruit should be eaten separately. They should not be eaten with curds and all, or with milk. You know, many people take mango milkshake. No, mango is something, it's a sour fruit. It does not, Ayurveda says it should not be taken with milk. But we all love it. So that means we are eating the wrong combination. So all these things cause problems. So let us take a common Indian example. A man wakes up, but he says he has woken up late, so he skips breakfast. But in the process, what does he do? He has to take something. No, he drinks strong tea. Then he rushes to office. And there at 11 o'clock, there is a small tea break. And he eats samosa and chai from the canteen. And then at 2 p.m., he has dal chawal. And he eats dinner at 10 p.m. So as a result of all these, what happens? His blood sugar spikes 3 to 4 times a day, because he has eaten wrong combinations. Because when you drink strong tea with milk and sugar, so naturally your blood sugar will spike up. And as a result, the pancreas, it gets exhausted. And since he does not have proper sleep, yes, he gets up late means he has not had a refreshing sleep. So his sleep cycle breaks down. His digestion, as a result, slows down. And in the process, what happens, since he has eaten samosa and other things and eaten dinner at 10 p.m., his liver starts storing fat. And it eventually ends up as a fatty liver also sometimes. And because he has been having a sedentary, inactive life, his muscle function declines. And such a person, by the age of 40, what does he have? He has a pot belly, he has low energy, he has poor digestion, and then his blood report says he is pre-diabetic. And he also has fear of medicines. So it is not really a disease of sugar. It is a syndrome of dysfunction, because his digestion is improper, his liver is not functioning properly, etc., etc. It is only a syndrome of dysfunction. So this being the case, in LMLT, what we do, we work at different levels. That's the good news. LMLT works at the level of nerves, muscles, organs, and hormones. So we stimulate nerves. We have special treatments. One of them is called medulla treatment. You might have all heard about it in our groups. Okay, in my classes, the medulla treatments, this stimulates the nerves. Then we give pressure at certain strategic points. By this, we activate the blood flow from areas of excess supply to areas of deficit supply. And this is what we work on the muscles. Then we work at the level of organs by improving oxygen and nutrient delivery. And finally, we work by giving proper command to the hypothalamus, pituitary, etc. We work on hormones by resetting the command system. So what your doctor may not tell you, but we tell you, diabetes is not lifelong. When will it be so? If you restore organ function. So people may say, some doctors may say that your pancreas is dead, it's not functioning. It is not dead. We say in elementary, it is either asleep or it is overworked. And then they will blame the liver and the adrenals, because they will say these are increasing your blood sugar. So the real thing is, it is not just the pancreas which is not functioning properly. The liver and adrenals are not functioning properly. And then the nerve flow and muscle tension can determine how much sugar you use. So this is what Lajpat Rai Mehra's neurotherapy teaches you, how to help your body to work again without needing a single pill. So now we'll see what makes Lajpat Rai Mehra neurotherapy different. So, having heard all whatever I have said, you must be wondering, if diabetes is not just a sugar disease and medicines are only controlling the numbers, then you must be wondering, what can actually heal me from within? Yeah, this is where the system of Lajpat Rai Mehra's neurotherapy comes in. And how does it come in? It comes in like a ray of light in a room that has been kept dark for too long. So now let us understand what makes LMNT different from allopathy, from Ayurveda and homeopathy, from acupressure, massage or Reiki, or pranic healing, and yoga and diet only approaches. So these are the common approaches, allopathy, isn't it? What are the common approaches for medicine for diabetes? Either it is allopathy, Ayurveda, or homeopathy, or it's a combination of acupressure, massage, Reiki, pranic healing, etc. Or some people have yoga and diet only approaches. While all these things may and do, especially yoga and diet only approach does help to a certain extent. But let us see what is the vision of Dr. Lajpat Rai Mehra. Dr. Lajpat Rai Mehra was not just a healer. He was a researcher, a physiologist, and a visionary. And he gave India one of its most practical and scientifically sound healing systems. So what did he believe in? He believed and professed that ailments arise when the communication between the brain, the nerves, the muscles, and organs, it gets disturbed. So I repeat, Dr. Lajpat Rai Mehra would say that ailments arise when the communication between the brain, the nerves, the muscles, and the organs, it gets disturbed. So anything which gets disturbed, we can definitely rectify it, because disturbance means disease and we can bring it to ease that way. So he always would say, tell us, always question yourself, can we retrain this communication? Can we stimulate healing by improving the function of muscles, nerves, and blood vessels? And can we do this all without drugs by using the body's natural design? You'll say, think about this. And then he will give the answer also. The answer is yes. And because that is how LMNT was born. LMNT, what is it? It is a pressure-based healing system that uses stimulation of nerves. It increases the blood supply through the blood vessels. Then it uses the physiology of muscle contractions, and it is a reflex-based organ stimulation. But all this we are doing without any medicine or supplement or surgery. So now let us see what LMNT is and what it is not. Okay. LMNT is based on neuromuscular anatomy. Okay. And it is not just a pressure point system like acupressure. So it is based on neuromuscular anatomy. And it is a treatment system, not a feel-good massage. Because some of the techniques may appear like massage, but it is not a relaxation therapy. It is a treatment system. Then it is based on organ stimulation via muscle contraction. It is not a spiritual or energy-based system like Reiki or pranic healing. It is focused on organ stimulation via muscle contraction. I just stop here for a second. If anybody wants to take the screenshot, please do so, because this will help you to convince your friends your own family members what LMNT is and what it is not. You should know. Okay, so you can take screenshots of this. Okay, then it is designed for clinical and chronic conditions. It is not only for general well-being. That means it's general well-being also we can use it, but it is specifically designed for clinical and chronic conditions. And finally, the best part is it is customizable, it is scientific, and 100% drugless. So it is not reliant on any medicine, herb, or supplement. So this is what it is. Okay. Then we'll first talk about why is this important for diabetes. Because in type 2 diabetes, the pancreas is not dead. It is just underfed and overstressed. So we don't say the pancreas is dead, and that is why you require tablets from outside. No. And we have seen that the nerves to the pancreas are often compressed due to either poor posture or poor circulation or inactivity. So all these three things. When we are not sitting straight, so we slouch and sit like this, or we sit like this, we sit with our one hand on our cheek, etc. These are all poor postures. Okay. Then poor circulation, I have already told you that inactivity, sedentary lifestyle will lead to poor circulation. That is why an early morning exercise or yoga based program is always very useful. And then in type 2 diabetes, the liver is overwhelmed, and so it stores excess fat and unable to detoxify properly. And the adrenals are always on due to chronic stress and lack of rest. And finally, the intestines are sluggish, leading to toxic buildup and glucose recycling. So if you treat only the sugar level, which is what most medicines do, you are missing 90% of the disease process. But if you treat the neuromuscular organ loop, then the entire system reboots. So let us see, how does LMNT actually work? So we LMNT practitioners, we use manual pressure, either with thumbs, knuckles, fingers, or palm, and we use it on specific muscles and nerve zones of the body. And what happens, this pressure is applied for about 6 seconds. So when this happens, two things happen. Number one, muscle blood flow mechanics. The blood flow temporarily stops in the compressed muscle. So when we are pressing in a particular location, the blood flow below that point where we are pressing, that blood flow is stopped. And so what happens, excess, the blood which is not able to go down, then we can say it sends a backsplash. And so its effect is felt in some other point where we want. And again, when we release the pressure, then immediately blood rushes in, similar to opening a floodgate. So immediately the blood starts flowing with greater force and with helping the body. And by doing all that, what happens? This oxygenates and clears waste from the muscle and organs linked to it. So this is the first type thing happens. Then the second thing, nerve muscle reflex activation. Each muscle is linked to specific autonomic nerves. When you stimulate a muscle, then the corresponding organ gets triggered. For example, when we stimulate the rectus abdominis, it activates the pancreas and liver. And how is it? Like an example, it is like giving a reboot command to a frozen computer. So when suddenly a computer freezes, what we do? We just give it a reboot command. So in a way, LMNT works something similar to that. Okay, then we'll see also further. Let us see some more examples. So imagine your home water tank is blocked. What do? You pour water from above. That is like medicines, giving medicines. The pipe is choked, but you are giving medicines, more medicines. But what does LMNT do? It goes to the choke point and removes the block and restores natural flow. So instead of managing sugar artificially, Lachpatrai Mehra's neurotherapy, it restores the pancreas' own insulin production. Very important. We restore the pancreas' own insulin production. It improves the muscle uptake of sugar. It enhances blood flow to the digestive and endocrine organs. And finally, it supports kidney filtration and bowel clearance. These are very important in diabetes. So now let us see the neuroendocrine logic behind diabetes treatment in LMNT. So in LMNT, every treatment is scientifically designed combination. What are these combinations? Number one, muscle pressure points. Number two, the sequence of stimulation. You cannot stimulate in any random order. There is a particular sequence. You have to do first this, then this, then this, then this. And then the duration intensity is also very scientifically and strictly worked out by Dr. Mehra. And then the organ response expected. This also is known. So when I press here, I know a particular point the pain will reduce. When I press in another place, pain in another place will reduce. And whenever pain reduces, it means that place has got proper circulation. That is the logic. So that is how we are working. So now let us see. We have got treatments. Different treatments are there. I will just give you the principle because you must know that this neurotherapy is not a random therapy. So we target the center abdominal muscles. They all have got different names and which we teach you when you come to the class. We'll teach you the name and we'll teach you what it does, etc. But some of the names are known to you. Rectus abdominis, that is the center abdomen muscle, rectus abdominis. Then we target the external oblique, and then we target the diaphragm and intercostal. So by doing that, what organs are influenced? The pancreas, the liver, the small intestine, and the vagal nerve tone, the tone of the vagus nerve. So we have got different formulas for it. And what is our logic? The elementary logic is the rectus abdominis is directly linked to the pancreas nerve root. Liver stimulation through the right side, it activates bile flow and liver detox. And then the diaphragm, we are giving treatment to the diaphragm. It lifts congestion in the abdominal vessels. And by doing that, what happens? It improves oxygenation. So we had a 45-year-old diabetic in Jaipur. He had bloating, belching, and rising sugar. Even on metformin, his sugar was constantly rising. But after 10 treatment sessions of neurotherapy, his bloating vanished, stool improved, and fasting sugar dropped from 160 to 115 without any medicine change. That means he had his, earlier he had metformin and still it was not improving. But when we gave him neurotherapy treatment, then his sugar improved from 160, it came down to 115. Okay. Then we have a treatment for kidney and the lower digestive organs, lower digestive axis. So what muscles are we targeting? We target the iliopsoas muscle, then quadratus lumborum muscle, and lower abdomen lateral wall. Why am I giving all these names? Because most of your healers, you know all these names. And those who are patients, don't worry, you will get to know their functions when you join because you have joined the course or you will be joining the course. So we'll teach you everything. But healers will understand what is the iliopsoas muscle or what is the quadratus lumborum, etc. the lower abdomen lateral wall. So these three muscles, they are influencing which organs? One, they influence kidneys. So then when kidneys are influenced, it filters glucose and maintains blood pressure. Then they influence the adrenals. So it controls cortisol, which is very important for sugar balance. Then they influence the colon, because the colon is necessary for glucose recycling. And our logic for this is that if the kidneys are sluggish, then excess glucose remains in the blood. If the adrenal stress raises sugar artificially via cortisol, and then when there is colon constipation, more glucose is reabsorbed. So we had a 60-year-old retired postmaster in Nagpur. He had rising HbA1c in spite of insulin, taking insulin. Then we gave the above treatments. Then within 3 weeks, his blood pressure normalized, his urine flow improved, and post-lunch sugar dropped from 280 to 165. So that's how it is. Then we have a treatment for prostaglandins, and this targets the paraspinals, the thoracolumbar muscles, and the latissimus dorsi, the origin, and the erector spinae. So by all this, what does it influence? It influences the immune system, the prostaglandin balance, and overall inflammation. So our logic is type 2 diabetes is a low-grade inflammation condition, and prostaglandins, they control blood vessel tone, they control insulin response and organ repair. Then by stimulating this, it helps in resetting inflammation, especially in fatty liver and obesity. Then we have treatment for the gut-brain axis, and it targets the gluteus maximus muscles, the hamstrings, and the lumbar fascia. And by doing that, it influences the large intestine, the lumbosacral nerves, and also the endocrine tone via spinal cord. And what we say, people who are sitting for a long time, they have weak posterior muscles, and that affects the spinal nerves. And then the back pressure affects the gut peristalsis and sugar metabolism. And our treatment restores gut-brain communication. So then, if wherever needed, we give treatments for digestion, then treatments for brain-pituitary coordination, etc. So you will ask, what happens after these treatments? Usually we have seen that after 2 to 3 weeks of regular LMNT treatment, the digestion improves, there is less bloating, there is more energy, sugar begins to stabilize, morning sugar drops, that is called dawn phenomenon, it comes down, then urine output clears because the kidney flushes excess glucose, and then constipation reduces, so there is better glucose recycling. And finally, mental clarity improves because there is lower stress and better sleep. So even if the sugar doesn't drop suddenly, by all these, your overall system gets balanced. And we say that is really the true healing. So now let us see some Indian case studies and real life transformations to element. So we are taking you to real homes, real people, and real lives, not celebrity stories. Okay, stories of common Indians like teachers, housewives, drivers, small business owners, all people who trusted their body and tried LMNT. So let us take the case of Mrs. Rajam, 53 years, school teacher from Tamil Nadu. 12 years ago, she was diagnosed with type 2 diabetes. Her fasting sugar was 180, PP was 290. She was on metformin and 8 units of insulin. But she always had a complaint of leg swelling, weakness, acidity, constipation. Then when we give our elementary protocol, in 3 weeks, acidity vanished, sugar stabilized at 150 to 180, And then in 2 months, insulin was stopped. In 6 months, HbA1c reduced from 9.2 to 6.8. So today, she walks daily, she teaches full time, manages her health without fear. And do you know what she says? She says, this treatment has given me my energy and dignity back. Then we have a homemaker from Lucknow, Srimati Pushpa Devi, aged 61 years. And she had a sedentary life due to which she was overweight, 84 kg, and she had diabetes for 8 years. And she was taking 3 tablets a day. But her complaint was burning soul, night urination, and forgetfulness. Now, many of you may be having all these problems, and that is why these cases will help you to understand that neurotherapy can help in all these cases. So, when we gave her neurotherapy treatment for glute spine coordination, digestion, etc., liver, kidneys, then outcome was burning feet was relieved in 10 days. 10 days, burning feet was relieved. Then after 4 weeks, night urination reduced from 4 to 1. Earlier, she had to get up 4 times, and now she gets up only once. Then sugar reading is now in 120 to 160 range. Means very, very comfortable, though yet she has to take treatments. And now she teaches her grandson how to press T13. This is real empowerment. Her grandson does the treatment for her. Okay, and that is all because we have taught her how another person can help her to give the treatment. Then we have a Mumbai railway employee. He's a retired employee, Mr. Sanjay Patil, aged 47 years, and he had diabetes since 5 years. Okay, and his complaint was fatigue, anger, and sudden drop in energy after lunch, post lunch energy suddenly dropped. And he had high BP, a bloated abdomen, and skin dryness. So after giving LMNT for 3 weeks, energy improved by its second week, and BP normalized by the end of 3 weeks. And in 2 months, he stopped his tablet under medical guidance. And the best part is he trains others in LMNT part-time. So these stories, why I gave these stories, it shows that diabetes management is not about controlling numbers. It is about restoring the function of the different organs. And that is what we are doing. So now let us see what you will learn in this workshop. You are not here just to lie down and get treated. You are here to learn, feel, observe, and practice. And so this workshop is not for passive patients. It is for those who wish to understand and transform. So what are the key topics we will be covering? We will be teaching you how to understand how LMNT works. That is muscle nerve organ mapping. Then we will teach you the importance of the pressure duration, 6 seconds, and the sequence, when to use which treatment, how to observe healing signs, that is, to give example, better stools, warmth in the limbs. Earlier you might have many people complain of cold hands and feet, but after 2 or 3 weeks of neurotherapy treatment, then they say their warmth has returned in their limbs, then they feel mentally fresh, etc. Then we teach you what are the treatment protocols and how and when to apply the liver pancreas treatment, or the kidney treatment, or inflammation control, or gut brain reset, etc. And all this you will learn with real demonstrations and hands-on guidance. And in addition, you will also learn how to treat your own parents or spouse, either parents or spouse and children, of course, how to treat them at home, then how to observe the signs of over or under stimulation, and most importantly, when to consult a doctor for medication tapering, and how to structure a daily LMNT protocol, a diet and movement. Then we'll see What are the lifestyle practices to be taught? Like correct eating order, then morning cleansing practices, then seed rotation, that is eating specific seeds in a cyclic pattern, then post-meal walking techniques. After meals, you should have a walk, then breath holding techniques to strengthen the diaphragm, and yogic moves to support gut, liver, pancreas, blood flow. So, in short, I will say this workshop will empower you with knowledge and practical skills and confidence. Knowledge, practical skills, and confidence. All three. You will be empowered with all these three. So now, what are the expectations, commitments, and lifestyle discipline? Let me tell you, LMNT is not, I repeat, not a shortcut or a substitute for effort. It is not a magic treatment which you take once and forget. It is a path of discipline and awareness. So, like any transformation, it needs consistency. So, what LMNT requires from you is commitment to attend fully. Each treatment builds on the previous day's work. Then skipping days, suppose you skip day one day, then it breaks the healing rhythm. So you should attend. Ideally speaking, I will try to finish within 8 weeks, or at the most 1 or 2 more weeks may be required, depending on the number of people who join. Okay. So more numbers means a little bit 1 or 2 more extra classes you will get. So let us see. Okay. Then willingness to observe and report. You should track your sleep, energy, stools, sugar readings, urination. All these you have to observe and you have to report properly. Then don't focus only on numbers. Look for overall vitality improvement. That's most important. People will say, sir, my sugar level is not reducing. It is still at 160 or 190 or 200, whatever. Then I will say, what is your energy? Sir, I feel very energetic, sir. Then what is your sleep? Oh, I sleep very well, sir. So now everything is proper. Then why are you complaining? So we say don't focus only on numbers. Look for overall vitality improvement. And then honest communication with your doctor. Never stop medicines without approval. The doctor has to approve if you have to stop medicine. And then share progress reports with your physician. Tell your physician, I am taking some treatment by which, look at it, my sugar level has come down. So please help me to reduce my dosage, etc. And most importantly, what we need is family support. Healing is easier when someone in the family supports your practice. And invite them to attend the workshop with you. You can join any of your people. Okay, if to learn this knowledge and even practice it on themselves, all that they have to pay is a very nominal sum of 1,000 rupees. So you can help them and invite them to attend the workshop along with you. Okay. Again, I say what LMLT will not do. It will not give overnight sugar reversal. It is not meant for type 1 diabetics. No, I will say it is for type 1 diabetes. We have got, sorry, this is a mistake. For type 1 diabetes, we have separate protocol. For type 1 diabetes and or pregnant women. Okay. It is not a substitute for medical emergency care. Yes, but it will definitely restore your body's ability to regulate itself. It will reduce medicine dependency step by step. And finally, the best part is it improves the quality of life dramatically. So finally, we say the power is in your hands. We'll close this introduction with the thought. What brought us all here? Many of us were told once a diabetic, always diabetic. But today I hope I have been able to convince you that if the body created the disease, the body can also heal it if given the right inputs. Most important, if given the right inputs. Okay. So in LMNT, we use no medicine, no machine, no foreign intervention. We just use our hands, our awareness, and most importantly, our trust in our body. So to every participant, I say, you are not your blood sugar report. You are not your medicine list. You are a living body with nerves, muscles, vessels, and potential to heal. Most important, we all have the potential to heal. And this workshop is your first step into a path where touch is therapy, muscles are medicine, awareness is healing, and you are the healer. So let us begin the journey. Okay. So I thank you. So it is a bit more than 1 hour. Let the healing of hands meet the intelligence of the body, and together let us create a future free from diabetes. Jai Hind, Jai LMNT. Let the healing begin. Okay. So I'll just now we'll see what are the participants' questions.
I request all of you to raise your hands and also your videos, please. And please ask related to the, upcoming paid class only. Thank you. Please raise your hands for your queries. Don't ask your personal questions on any health, only related to the paid class. You are welcome.
Just hold on. I'll just... Mr. Pinto, please wait a minute. I'll just connect the other microphone. It is Madam, sorry, Jacinta. I'm sorry. Okay, please wait a minute.
I request all of you to please keep your videos on. Keep your videos on and raise now itself, because at the end of the session, if you're raising at 9:30, 9:25, we are not going to answer you. So please raise now itself.
Okay. It's a key. Speaker ta konta ne wo?
Any more hand raises? Ask now itself.
Yes.
Raise your hands now itself.
Yes.
And videos on.
Madam Pinto?
Yes.
Yes, please.
First is, I guess, Sonal.
Acha, Sonal. Sonal Mamtoraji. Yes. Okay.
Oh, thank you very much, Acharya-ji, for this lovely introduction. It really gives us a good insight into what the therapy involves. My question to you was that I am pre-diabetic. I'm not diabetic as yet, but I have a family history of diabetes. And so I'm wondering, is this right for me or not? Or is it only for diabetics?
No. It is for pre-diabetics and people who want to keep themselves free from not even going into diabetes. So we will have certain formulas for them also for not going into diabetic at all. But for pre-diabetics, definitely you will definitely get benefited, because we have got, the treatment protocol is also for when we have a separate formula for people whose parents are diabetic. That means who have diabetes in the family. So
yes.
So with that, definitely you will get benefited. Have you already joined?
Oh. No, I haven't joined it as yet.
Okay.
But I just wanted to find out if it is helpful for pre-diabetics or not.
Certainly, it will be very helpful to you. Sure.
Okay. All right. Thank you very much.
Welcome. Thank you. Please join. Okay. Now, Anusha Madam, who will be the next? Is it Jacinta Pinto or Dr. Chandrakala? Jacinta Pinto. Yes, Madam.
Good evening, sir.
Good evening.
I am type 2 diabetic and I have enrolled myself for the treatment. My question is, what are the prerequisites we need to do? I mean, whether we need to do some test and show you the report, whether you are sending us some format to fill up or what is it? How
Very
are
good.
you? Yeah.
Very good question. Exactly. We will be on the first day. I will be uploading for once I know who are the group members in that group. I will be uploading a questionnaire. All of you have to fill up that questionnaire. I'll be discussing how the questionnaire is to be filled up also. I'll be one day before this thing. I will be uploading it as a PDF, or you can even people can on the same day also they can see the PDF, and then it's a very simple questionnaire, and the questions, the way how you answer, everything will be discussed with you, and definitely that's all you have to do. And of course, testing, it is a good question because you must have a latest, recent, at least reasonably recent the sugar test report, either HbA1c or this sugar. It should be recent. You cannot say I for 5 years ago I had a test and I am taking tablets now, so I am not tested again. Then it will not be so very relevant. So it will be better if you can go for this thing, which I will be writing. It's a good question. I will put it immediately today itself for all those people who have already joined. I will write in the group, please have a recent blood test report. So I mean blood sugar report. Okay. Thank you. Very good.
Thank
Yes,
you.
thanks a lot. Thanks a lot. I love it. Yes. Next, Dr. Chandrakala, madam, please go ahead.
Sir, namaste. Hello.
Yes, namaste, ma. Namaste.
Sir, I am a pre-diabetic. I am not a diabetic, but my husband is diabetic, sir, since 8 years. I want to help him, sir, through this course.
Okay. Perfect.
So I want to upload his reports.
Yes.
And I want to discuss with you, and I will follow whatever protocol will give, sir. I want to help him, sir.
Definitely, definitely. Very good thing. Very good thought. Because what we are teaching, he can do, the treatments will be such that we will, how you can help another person, that portion also I will be teaching, and how he can help himself, that portion also I will be teaching.
Okay, sir. Thank you, sir.
Welcome.
Okay.
Please get his latest blood sugar report. Huh?
Okay, sir. Okay, sir.
So when we give the form, in that you will have to fill up those details. Yeah. Go ahead.
I request iPhone, please change your name and please switch on your videos. When you are asking queries, you please switch on your videos. Pradeep, switch on your video. iPhone, Pradeep, Sumat.
iPhone, what is the name? Please write your name or let us know what is your name. iPhone.
Yeah, Pradeep, please.
I just want to know this any background regarding this medical thing is required to learn this, or a normal person can understand?
Yes, absolutely. Yeah, no, the only requirement is you must have an idea, an attitude to learn a new therapy. That's all. You don't require any medical knowledge. This is just a pressure therapy. So medical knowledge is not needed. And what medical knowledge is needed, I have discussed with you today. I have tried to keep it very simple. Like that, I will be discussing very simply only. So that medical knowledge, it will keep you abreast of your condition. If you are yourself a patient, but if you are learning it for another person, definitely you don't require any prior medical knowledge. You can learn it.
And this is only for the diabetic, or any other ailments also?
No. Diabetics will have many ailments along with their diabetics, so it will benefit them. And for other ailments, if it is
No, my husband is BP patient, so it will help him also?
Yeah, some of the treatments will help him. Though if we will be teaching certain treatments, it will help because many diabetics have blood pressure. So when we are giving that treatment, it will help him also, definitely. And we recently had this thing on blood pressure. I some 2-3 weeks ago, I had a lecture on blood pressure also. I showed some formulas. So we'll discuss it. You can join anybody who is a participant. If it is not too much out of my way, I will tell it on the spot. Otherwise, we will come for a Zoom session later. If it is any specific problem you are having, definitely you can. But first you join and then we can discuss.
This is, sir, this is for how many days?
This is approximately 8 weeks. That means 8 Fridays.
Okay.
It will be only on Fridays. It will be through this Joshi Kerala group Zoom sessions only. And it will be for 8, maybe 1 or 2 more extra sessions may happen if the number of people go up higher, then 1 or 2 extra sessions may happen. That's all. But I'll try to get to 8 sessions.
Thank you so much.
Oh, welcome, welcome. My pleasure. Yes, who is next? Sumati madam. Huh?
Yeah.
Yeah, Sumati madam.
The iPhone is not opening.
Yeah, I don't know. I don't understand. They are having some problem. They're unable to rename themselves, I think. At least they can tell their name.
Yeah, they're not even.
Yeah, okay. Sumati madam, namaste.
Yeah. Unmute.
Namaste, sir.
Namaste, namaste.
Sir, recently I have gone through a angioblast. Can I attend this class?
Yeah, you can attend this class, and then certain things for heart patients we will say that don't do this particular exercise. So then that you need not do. Other things you can do.
But I don't know whether mine is I'm diabetic 2 or 1.
No. You can. It won't be diabetic 1. Diabetic 1 starts right in the right from childhood. So it will be most likely diabetic 2 only. You just give me your blood sugar report, then from that we can see.
Okay, because I'm not taking any insulin.
No problem. That may be, you may be pre-diabetic perhaps. We don't know.
Okay. So I can join this course.
Yeah. Definitely. Well, most welcome.
Okay. Thank you so much, sir.
Okay, my pleasure. Thanks a lot. Thanks for the query.
iPhone is still not opening the video.
I don't know. I think he is not even opening, he or she is not opening their mouth. At least, I don't know. Maybe they are nervous or something. No idea what is happening.
Can you unmute yourself, iPhone?
iPhone has raised their hands, but we don't know who it is.
Unmute yourself. Switch on your video. Okay, we'll go to Shashi Kumar.
Yes, Mr. Shashi Kumar. Yes. Yes, Mr. Shashi
Hello,
Kumar.
sir. Good morning, sir.
Namaste. Namaste.
Sir, good evening, sir.
Good evening. Yeah.
Namaste, sir.
Yeah.
Sir, actually, my wife is diabetic, sir.
Okay.
But she can understand only Kannada. I am from Bangalore. So can I join in her name and guide her, sir?
Yeah. Why not? Why not? Definitely. You send her report. Send her, when I ask you for the report, then you send all her details. Yes.
Sure.
Yeah.
Okay, but
sure.
I will attend all the classes and I will guide her.
Yeah. Perfectly. Yes, definitely. You can do that.
Thank you, sir. Thank you.
Okay.
Thank you so much, sir.
Have you filled up the form? Have you made the
Yeah,
payment?
not yet, sir. I have to join till now. No, I have to join now.
Okay.
I will join today.
Okay. Welcome.
Okay.
Okay. Thank you very much. God bless you.
So all the queries are over for today. Any more you raise now itself, please? Raise your hands now itself.
Now, if anybody has any other query other than diabetes, you can ask the question. I will take 1 or 2 till 9:30, 9:25. We will stop. Yeah. Now,
And
Dr.
anyone
Chandrakala has.
Have feedbacks? You can share that also.
Yeah. If you have feedback, yes.
From past class, I think MS Rajeshwari ma'am is there. Some others are there.
Yes.
If you have any feedback, please share because others will know. Thank you.
Yes,
Hello?
Yeah, yes, madam.
No, this week only I joined your Kerala group, sir. I'm very happy, sir, that I joined. So many information I'm getting. When kidney stone videos, your class I was watching, sir, that your exercises, the sitting posture, I can't sit, sir, in that position.
You mean like this? You cannot sit?
Yeah, so a little difficult, sir.
No, don't worry. You sit with your legs like this, no? You can sit like this. You can sit like this. Like this.
I
You know?
can't see, sir.
Oh, okay. You can't
Not
see.
visible.
That means I say you can sit in a
Just
chair,
like
you know,
sitting in a
like you
chair,
are sitting
yeah.
in a chair.
Yeah, can I sit on chair and do, sir?
Yeah. Some of them you can do, and those which are very difficult, you can ask some friend to help you.
Okay, sir.
Your son or daughter or anybody, they can help you. Because you see, some treatments may have to be given on the hand and thigh, together. So if you cannot do it yourself, then you will require somebody to help you.
So that P6, that like in Thai tapping, the in sitting position, it was very difficult. That's why.
Yeah. So no, those things you will require another person. What is your weight? How much is your weight?
Weight is 90 kg, sir.
So that is why slightly a little bit difficulty will be there. If you have another person, your son or daughter-in-law, whatever, then they can help you.
Or on the in chair, sir.
In chair also you
sit
can do.
and,
Yeah, you can do. So sitting on chair, you can sit and do. Definitely.
Thank you, sir. Thank you, sir.
Welcome. Okay, anybody else? Roshan,
Anyone ready
madam.
for feedback?
Yeah,
Anyone?
anybody for feedback, right?
Anyone would be interested to give me a feedback from your past session? There was a paid first session of diabetes challenge. I request any one of you to please come ahead and give your feedback of the first session, how it was helpful to you. If you joined again, you can give it in the main group, paid group also, so that others could know. It's not necessary. If you don't want to come ahead, you can share it in the paid group if you joined again. Okay. So any more queries? Asking you for the last time.
Yeah.
Any more queries? Any more doubts?
Okay.
I want you to please
Ganesh Pandey.
Yes. Video.
Yeah.
Switch on your video, please.
Ganesh Pandey ji, please switch on your video.
Okay, we'll go to next person. If you are not switching on the video, we'll go to next person. Simple.
Yeah, Sister Mercy. Thank you very much.
Yeah, good evening, sir.
Good evening. So nice.
Sir, you are wonderful, the session, sir.
Yeah, my pleasure. So,
sir, I tried for those who are vomiting during pregnancy, 3rd month and 5th month. They all are very good after trying the exercises. And thank you so much for guiding us. And you are so patiently you are guiding our questionnaire and our doubts. Everything are so peacefully we are learned also. And thank you so much. I really heartfelt thanks I'm giving you. Wherever you are, the God will guide you.
Thank you.
And your health will be good in all the conditions, sir.
Thank you. I need it. I want to serve more people. Yes,
sir. You can meet so many people also, and you can give your valuable treatments.
Sure. Thanks.
Thank you so much, sir.
Thank you, sister. Thank you,
Okay,
sister,
sir.
for your. Okay. Thanks. Okay, wonderful. Anybody else? So, Pandeji, you had raised your hand. Pandey was he?
Hello, good evening, sir.
Good evening.
Sir, I'm not able to open the video because I am in a kitchen. I am alone.
Okay.
You know,
Yes.
you know about me. Last session I joined by
Yes.
by the payment.
Yes, I agree.
So just now last week, because I am alone and I am in a pharma only, so I have to visit a plant. So my random food and stress is there. So just now I have checked HB1C is 9 right now. Last Sunday only. And cholesterol is increased. So my main question is there, sir, the exercise or what the points last you have shown me, that is necessary in the morning, evening, or whenever you want to do then only, because I'm not able to do in the morning because I am a late night person.
No problem. That is why the cholesterol is going up, because late night always spoils the digestion. So it doesn't matter. Now you do it whenever it's possible. You do it 2 to 3 times a day, and especially the one which I have shown on the leg one, you do it before every meal. Whatever time you have your meal, you please do it before that.
No, I will join again to remember it, because many times I will not join for the work or anything. So I have not remembered much of that lessons.
Okay. Please join again. Yes.
Yeah. So you can share the link and all the things.
Yeah, it is there in the group. Today also, Madam has put it. It's there in the group.
Because next month my exam is there with the IGNOU. So for me, just now I am doing some paperwork also. So I am listening to you. So every Friday at 8 o'clock, na?
Yeah, every Friday 8 o'clock. Right.
It is okay, because online is good for me. If it is in video, I will not get more on that. Sure, what is that one? Because I'm in a pharma, so I'm not. I don't know about the much pressure, recuperation, all the things.
No problem. I'll teach you definitely.
So again, I have to fill the form.
Yeah.
Because
again,
I
you
have
have to
filled
fill up
again.
the form. Again, you have to make the payment. Yes.
Payment I will do, but previous form, that is the same. What is my meal and all the things?
No,
Again, I have to write
see.
it.
I will have a look at it when you come into the group. I will have a look at it. If that is enough, you just remind me. I will see it, and then I will take from that. No problem.
Okay, sir. Okay, thank you.
Okay. Welcome.
Okay, good night, sir.
Okay. Yes, Mr. Pradeep NP. Mr. Pradeep, you can unmute.
Yeah.
Yes.
I just want to ask because I'll be traveling in some of the Fridays, so what to do then? That is the issue.
Will be available in the paid group. You can go and check there every time. So that should not be a problem.
So
But you
if
have to make time.
any of the class, if I miss, then I can get the recording of that.
Yeah. It will be there in the same group. You can check the group in the media section or go scroll up and check it, because then you will find everything in the media only. And you have to spare time to go and check it out, because at least when you're attending in the next session, if you have any queries, you'll be able to ask.
Yeah. Before that only, I'll see this thing. Only I'm worried ki if I'm traveling and I'll not be able to attend, then what? Because I don't want to miss any of that's why I'm asking.
You should not, because the treatments will be informed, so you should not be missing it mostly. And do it soon after it is posted.
Okay. Thank you so much.
Oh, welcome. Yes, Mr. Sandeep.
Yes, sir. Good evening. So I am not a diabetic patient. Just I want to learn it. So can I join the program?
Yeah. Certainly. You learn and you can help others.
When this program start, actually,
July 11th, next week, next Friday.
Okay.
So you must
you
must make your payment within these 1 hour today or tomorrow. You make it, then you can join the group. The moment you make the screenshot, you put the screenshot in Joshi's Kerala group Telegram, and then the Madam Anusha Madam will join you in the correct place.
Okay, sir. And sir, this will be specifically focused on diabetes only, not anything else.
No. Diabetes and related issues like high blood pressure, etc., related to diabetes.
Okay, sir. Thank you very much.
Okay, welcome. Thank you.
So thank you everyone for joining this session. Now we'll finish the blessings from Sir, and then we'll continue with the rest of the things. Tomorrow and day after tomorrow, every day we have sessions. Please check in the group. Thank you. Over to you, sir.
Okay. First of all, I thank Joshi sir, Joshi's Kerala group, Anusha madam, and all the participants who have joined today and have attended my lecture. Thank you for your support, and may heaven's choices blessings be on all of us. May we and our families and our friends and their families, may all of us be benefited with health, happiness, harmony, peace, prosperity, and success. May each and every cell of our body and of our friends and relatives, their bodies be full of health, happiness, harmony, peace, prosperity, and success. Thank you very much. Till we meet next week. Thanks a lot. Good night.
Good night, everyone. Thank you, sir, for this wonderful session. Gratitude to you. I request all of you, wherever you have joined for this session, you please check the main group, Joshi's Kerala group, and join there. You can ping me personally so that I can send you the main Joshi's Telegram group. You please only ping in Telegram group with screenshots, because that is very important for us to make you join in the Telegram group, which has the paid group of diabetes challenge. So I request you only please message in Telegram only, that too Joshi's Kerala group, main group. If you are there in the paid group of diabetes too, you can message there. But mainly you please message in the Joshi's Kerala group. Who have already paid, they need not message. Those who are ready to pay, please go to the main group, or wherever you are there, you message there. We will share the main group's link so that you can join there and share your screenshots. Okay. So all the best to all of you, and thank you for joining. We will be waiting for the screenshots, because we need to finish the registrations at the earliest. Wishing you all a very happy weekend. And tomorrow, day after tomorrow, Monday, we have classes. Please join on time. Please check the group, and please read all the message thoroughly, because link, everything is shared in the message only. But again, you come back without checking the message and ask for links. So please check the message fully. The topic will be there, everything will be there, so that you can join accordingly, and you can ask queries accordingly. Okay. So please go back to the main group now immediately and share your feedback with all the details of this session, what you have learned in this session, how clear it was, and what are you looking forward for the paid session. Okay. So please go back to the group and please share your feedbacks, queries, whatever you have. You please go back and please write down ASH neurotherapy or at neurotherapy, whatever. Please specify this as neurotherapy or Ramachandran sir, so that he can understand this message is for him, because we have many trainers in the group and he has to know specifically which message goes to him. So please specify at neurotherapy or at Ramachandran sir, or use ASH. That is a very fond request, humble request from me for all of you to please understand and give your feedbacks or requests accordingly. Thank you so much. Till we see again. Good night. Good night. Gratitude sent to you from all of us for this wonderful session. Thank you, sir. Good night.
Thank you. Good night.
Ending the session.